Officer. To her left, we have Dr. Julio Sabido, and to the far right, we have Dr. Marvin Manzanero, Director of Health Services. I am your Mistress of Ceremonies. My name is Claudette Dakers Norales, and we will start with a presentation from the Minister of Health and Wellness. I will ask him to come up to the podium. Honorable Michelle Shebat.
Thank you very much, Mistress of Ceremony. Good morning, everyone. I'd like to start today by expressing my sympathy to all our citizens, to all of our friends who have lost family members and friends to this pandemic. Additionally, I wish to thank all of our doctors, nurses, public health inspectors, lab technicians, contact tracers, and all our frontline workers for the tireless service they have been providing during this pandemic. As you know, we assumed office a little over a week ago, and this is what we found. There was no clear strategic plan with a budget. There were no clear testing strategies. Up to the end of July, MOH headquarters was still deciding who got tested. The processing of swabs for PCR was and is still centralized. This has resulted in a serious backlog. Currently, there is a backlog of approximately 2,182 PCRs at the central lab waiting to be processed. People being tested are not being given their results in time. This has contributed to the spread of COVID. Despite a clear offer from Baja and the IAEA in April to assist with PCR testing to the MOH, this offer was not taken up. Our government hospitals are not fully ready to deal with a surge in cases should the need arise. This is despite the fact that the MOH had ample time to rectify and address these gaps. The Ministry of Finance reduced the budget for all ministries, including MOH, by 40%, and this is despite the fact that MOH is required to respond to the pandemic. Overtime for healthcare workers was cut. There were restrictions placed on the hiring of staff. There are limited masks and PPEs for healthcare workers. There was a lull during the lockdown for approximately 1 month where there were no cases reported. The previous administration should have used this time to develop a clear strategic plan to deal with the pandemic and to equip hospital and healthcare workers with the needed supplies. And this is compounded by the shortages of doctors, nurses, testing equipment, etc. This is the card we have been dealt with. But this government has, with the help of medical experts in both the private and public sectors, created a plan to move forward. We shall do all we can to curb this transmission, but this is not something that we can do alone at the Ministry of Health. This will require the public and private sector working together. But in addition, it will require each of our citizens to take this pandemic serious and to change behavior. The virus is being spread by human contact. On Tuesday, the proposal for surge capacity and the containment of the COVID-19 was presented to the cabinet, and approval was given for the injection of $15 million into the system. The plan moving forward includes the immediate implementation and scale up of the use of rapid tests in all district hospitals with clear testing protocols. All regional and community hospitals are now conducting rapid tests. We shall be expanding test sites throughout the country. And those sites will include, if I can just share with you, in Orange Walk, we shall have stationary clinics at the People's Stadium, Louisiana area, Blue Creek, August Pine Ridge, San Felipe, Guinea Grass, and San Pablo. And those will be in addition to mobile clinics, which will be in San Carlos, Indian Church, Trinidad, San Lazaro, Yo Creek, Fireburn, Shipyard, San Antonio, Trial Farm, Chan Pine Ridge, Carmelita, Santa Marta, San Jose Palmar, San Esteban, Douglas, Nuevo San Juan, and San Luis. In Independence, at we will have at Bella Vista as well, and Independence. Correct, nurse? Yes. Additionally, we will have mobile clinics in, that should have been Stan Creek District, my apologies. In addition, we're going to have mobile clinics in Placencia, Santa Cruz, Santa Rosa, Red Bank, San Juan, Trio, in the, and those are going to be the clinics that we're going to be for the priority areas at this moment in time. As we move along, testing sites will be added to these. You can also expect to have shortly from the MOHW now, MOHW, a schedule of when the mobile clinics will be visited the distinct areas. Additionally, with the new implementation of the rapid testing, in the information that is being shared with the public, you can expect to see rises in numbers of positive tests. And the explanation for that is a very basic one. Up to now, the results, the information being shared is based solely on the PCR tests. Now that the rapid tests are implemented, that information will be added to that infographic. We also intend to hire additional laboratory technician, lab aides, data entry clerks. We will hire additional contact tracers. There will be active surveillance by the Ministry of Health teams at private businesses, and we will urgently procure supplies and consumables for the extraction machine as well as an additional extraction machine. In terms of addressing the surge capacity for our hospitals, we intend to hire additional doctors, nurses, specialist support staff for deployment to all of our regions and community hospitals. We will seek approval of overtime for all of our essential staff, for general practitioners, registered nurses, nursing assistants, midwives, operating room staff, and specialists. Approval will be sought for increased oxygen procurement due to the increased demand as a result of the COVID-19. On average, 2 tanks per patient per day is being used. Approval for the additional medical equipment and supplies that include will be sought, and that is not going to be limited to portable ultrasound, infusion pumps, patient monitors, thermometers, and other lab and hospital consumables. In addition to these steps we are going to be taking, there will also be new public health measures put in place. Starting on Saturday, the 28th of November, a curfew will be implemented from 9 p.m. to 5 a.m., and this will last for a period of 21 days. Restriction of gatherings shall remain at 10 persons. There shall be work from home orders and or staff shift rotation for public and private employees. We shall be providing food packages and a stipend to families who are quarantined. We're also going to be providing hotels for persons who cannot quarantine at home. Our team at the ministry will be assessing housing conditions to determine adequacy of isolation and or quarantine. We are going to be asking the police to strictly enforce the quarantine measures. We are going to be providing accommodation and other logistics for healthcare personnel. We are going to be undertaking a health education campaign, a robust one as we had with the ICJ. Restaurants with outdoor facilities will be able to host up to 12 persons at a time. Those that do not will only be allowed to have takeout service. There will be no gatherings in public spaces, and stores and businesses will be required to have 6-foot markers and will only be allowed to have 20 persons at a time in these business locations. I want to assure the public that this Ministry of Health and Wellness understands the seriousness of this pandemic, and we shall be taking all the necessary steps to help to curb the transmission of this pandemic. Before ending, I want to remind each and everyone to take personal responsibility for your behavior. It is important for you to observe the protocols. Please wash your hands as often as you can. Please wear your masks properly. Please make sure that apart from your family, there are no gatherings of 10 or more persons. It is only with your cooperation that we can expect and we can hope to stem the transmission of this pandemic. Thank you all very much.
Okay, at this time, we will have a presentation by Ms. Lerna Perez. She's the National Surveillance Officer at the Ministry of Health.
Good morning. Can you hear me? Good morning to everyone. This morning, I am going to present some of our data with some explanations to that and some additional information that I have to share. We have the presentation up. Okay, so just to quickly give you an update of where we stand with the current situation. At the epidemiology unit, we try to come up with models as to predict where we're headed in regards to the outbreak. And our colleague at the epidemiology unit did develop a model that highlighted that the number of new persons that are being infected at the moment by a confirmed case is 7 persons. So you can imagine that for every positive person that we have, there are 7 additional persons that are being infected. So we have to take this in context, looking at the numbers that we are reporting as confirmed cases, and then you add the multiplier of 7. And of course, when we look at the data, we can see where the majority of the cases are in the northern part of the country. Actually, if you do the math, 80% of the cases are in the northern and central part of the country. And as such, the attention now is geared towards places that are showing the higher numbers, but we also have to look at the places that are kind of controlling it right now, because that is where we want to go. We want to ensure that the areas that are not having high transmissibility, that we can keep it at that way so that it does not overburden the health services. Okay, no, it's okay. You had it. So the previous one. Go back. No, not the previous one. Yeah. So this was the summary of yesterday's data. If you can notice what has been happening in regards to cases, that is dependent on what the lab can produce on a given day. So even though you might see some numbers going up from day to day in certain areas, we have to look at the picture holistically because of the way the samples are being processed. And that's why we can highlight that the problem when it comes to transmissibility really is in the Corozal and Orange Walk districts. This heat map is an attempt at showing you where the hotspots are, where are we having clusters or the outbreak. The color coding map is just showing you the districts first that have the highest numbers of cases, and then you look at the heat component of it, which just shows you the communities where most of the cases are being reported. And it is using this information that the minister highlighted the areas that need to be considered priority. Next. So at the moment, that is up to midnight last night, we had a total of 29,668 persons tested. Of these, 23,000 are negative, and almost 6,000 or 20% of these tests have proven to be positive. So our positivity rate is 20.1%. Of course, as the minister mentioned earlier, we have over 2,000 samples pending, and out of this, the projected positivity rate, again, as I said, depends on where these samples are really coming from. Currently, well, this is up to this morning now, the hospitalization stands at 54 persons hospitalized, with 9 persons at the intensive care unit. Up to yesterday, at last night, midnight, we had recorded 129 deaths and 2,700 cases had recovered. So again, as I said, it's just looking at the facilities that have been providing the services, and just to show you where all our samples are coming from. These are just mostly public-private facilities that have been submitting PCR tests. Again, it's an expanded type of service, so we can see where all these, while the lab is so overwhelmed right now with the amount of samples that are being required. So this is both the public and the private sector samples that are being collected throughout the country. If we look at the distribution of cases now by age and sex, here we can see where the ages, again, we had mentioned this before, men are dying, men are actually not dying, are being infected twice as much as females. And then when you look at the distribution, that age group, that productive sector, we call it, the 20 to about 39, are the most affected groups, and these are the mobile population. So when you think about this group, these are the ones that are actually out there. They're socializing, they're working, they're commuting. So these are the spreaders of the infection. Next. This is just looking at the trend of the cases as we have been noticing it. Remember we had our first case in March, and since then, with the interventions that were taken, that first wave was contained. But since we started seeing the sporadic cases at the beginning of June, July, that is when the numbers started going up. And so we can see we have the peaks is just dependent, again, as I said, on the amount of positives that are reported on that particular week. And that is dependent on the samples that are taken, the samples that are processed, and the results that are issued. So when we look at the deaths now, unfortunately, as I said, one of the indicators that you look when you're looking at any infectious disease, you're looking at the case fatality ratio or rate, no? And then you see how much impact it has on your community. So here we can see the age groups most affected again are those, the elderly, but that does not exclude the young ones. We have had children, a child dying, we have had young adults dying. So we have to be cognizant that not because we are in a particular age group, that means we will not be affected. So the lifestyle we have, the care we take of ourselves and of our community and our families has a major impact on how well we can contain this virus. When we look at the districts, of course, we are having increased numbers of cases in both Corozal and Orange Walk, and that gives you a mortality rate of almost 60 per 100,000 population for Corozal and 95 per 100,000 for Orange Walk. And the national rate actually is 30.8. No? So if you look at that, it's 3 times the amount, the national rate in Orange Walk, and twice the amount in Corozal. So we can see where the impact of that, of the deaths are in that district, why the minister earlier mentioned priority areas. Stan Creek, the Banana Belt, which is the areas that the minister mentioned, is another upcoming area, and thus the reason why that area was identified as an area that we need to move in before it really gets to the point that we are looking at in Orange Walk. So when we look at the case fatality rate also, the Orange Walk and Corozal have, they're at 3 and 3.1 respectively, which is just telling you that that 3% of all the cases are dying. Next slide, please. Okay, and these are just some quick messages so people don't forget the hand washing. We're at a point where we need to prevent the area. I mean, so our communications officers and our health educators, they're working at promoting these measures. And so there you will find these information available at our website. If you need more at any particular place, you should always seek out these informations, because these are some relevant messages that need to be known by those who are affected and afflicted by COVID. So we need to be on the lookout for any additional information that we can get our hands on to ensure that we are well prepared for the for any event when it comes home, because it's just a matter of time if you do not take the necessary precautions. So here it just addresses what to do if you must leave your home, and it highlights again all the areas of prevention measures that need to be taken. Again, be aware of the symptoms. This is something that there is so much information now. You have testimonials, you have lots of literature out there. There's a lot of messaging happening. So pay attention to your symptoms. Don't wait too long to come to seek attention. If you do not know what to do, you could always call all the hotlines that are posted by the Ministry of Health so that you can get further information in that regard. Again, this is just general information. How is it transmitted? Looking at home care, because I mean, there is a point in time when our hospitals not will be overwhelmed, because some of them are already overwhelmed. And so there are some basic things that you can do at home. You really do not want to expose additional people within the hospital setting. So whatever you can do at home, you try to do that. Again, as I said, if you do not know, please reach out to the Ministry of Health to try to get some guidance in that regard. But these are just some little tips that are being posted in our social media platform, and I think these are posters that are available throughout the country. And of course, again, you talk about other issues like self-isolation. I mean, this is one of our biggest challenges we have in the that we have in the country. The ability to isolate. There are many factors that play as to why people find it so difficult to isolate at home. We ask them self-isolate or quarantine your family, but we have to understand that there are some social needs that need to be met for us to have full compliance of the general public with this, no? And then what to do if you're positive. Again, this is just a final message in trying to get persons aware what it means to be positive, because we know we are hearing all these some people take it quite in a relaxed manner, as if though, okay, there's nothing much, it's just like a flu, or you don't have any symptoms, so I don't need to worry. While you have the other extreme where people end up being hooked to a ventilator because of the severity of the case. So do not take any chances. Again, as I said, COVID is here and it's here to stay, and we need to take all the necessary precautions on a personal level to ensure that we stay as safe as possible. There is just so much that we can do as a ministry, and so we really need the cooperation of the general public in meeting the safety needs of all our citizenry. Thank you. Thank you very much.
We conclude with presentations from the head table at this time. We will now be taking questions from the media. I will advise that we will only be allowing for 2 questions per media house. We see a lot of persons have logged in already. We will proceed on the media houses based on their login order. So at this time, if we can ask Paul Lopez from Plus TV to ask your questions. Please, only 2 questions per media house. Yes, only 2. And we ask that others please try to ensure if your question is being repeated or if it has been answered, that it's not repeated again. So we will start with Paul.
All right, good morning to the head table. Minister, I heard you made mention of $15 million to be used as a part of the ministry's efforts. Can you provide details, perhaps in terms of, maybe I missed it, where is this money coming from? Will the ministry be receiving it in parts, and how will that $15 million be divided and spent?
Yes, thank you very much for your question.
Push the mic to you. Yes, like that.
Yes, thank you very much for your question. Cabinet has approved the $15 million, and so this will be coming through the Ministry of Finance. And as we had indicated in our presentation, the funds are going to be spread in a wide variety of areas, including the employment of additional doctors, nurses, contact tracers, and so forth, the acquisition of equipment. Also, we had mentioned that we need to be able to provide hotel for people under quarantine and so forth. And we spoke about providing food packages and so forth. So it is the entire ambit. It is all the areas that we are going to be attacking. And again, from making sure that our hospitals are ready, right down to providing food packages and a stipend.
I'm not sure that I heard clearly where this money is coming from, because I know the government is cash-strapped since the former administration.
As I said, this has been approved by Cabinet, and it comes with the direct approval from the Minister of Finance, and so that I am sure that the monies will be available through them for the use of the Ministry of Health and Wellness.
Secondly, since I only get two questions, these tests, you have listed at least 30. I didn't count, but I got at least 13 new tests. Are these tests coming free of cost to the public? These rapid tests, and I know this was a concern because the question also follows if this approach is even sustainable.
Well, the public health facilities are testing for free. We don't charge individuals coming to the public health facilities to do a test, right? There are, as far as I understand it, there are at least two private clinics that are conducting tests, and those do carry a fee with them.
So as for the sustainability of the whole operation in terms of getting tests, acquiring tests, and then giving them out for free, do we have the finances and do we have the test available in this matter?
Yeah, well, that's your third question, but it is we are taking this pandemic very seriously, and it is a priority for this government to deal with, and so we will be finding the funds to be able to continue our testing program. If we don't know our status, it is hard to plan, and so testing is going to be one of the hallmarks of this new ministry.
Okay, thank you, Paul. At this time, we ask Marisol Amaya. She can unmute and ask her questions. Marisol, are you there?
Good morning. I've already unmuted, so I'm not sure why. If you're not hearing me well. Head table minister, if I could just press you further on the first question by Paul, specifically, where is that money coming from? Are you, let me not use the phrase that's in my mind currently, but is it borrowing? Is it taking from other portfolios? Where exactly is it coming from?
Marisol, I believe that is a question better directed to the Ministry of Finance because they are the ones who are going to be charged with finding the funds for us.
I would have thought that if you are coming to
Very clearly, the figure of $15 million was not pulled out of the sky. This figure was put together by the technical people at the Ministry of Health and Wellness. And so that is how we came up with this initial figure, which I believe will cover an initial period of 6 months. That is the projection at this time. As you are aware, this pandemic changes from day to day. And so that we need to be able, our plan needs to be flexible. And we are planning on a 6-month basis as we speak. And this initial $15 million will go to cover that initial 6-month period.
Thank you for that. And then if someone at the head table can clarify this for me, how many of our hospitals do you consider are overwhelmed at this time? And can you define exactly what you mean by being overwhelmed? Is it that people are being turned away because they cannot receive service?
You have the occupancy. You have it? We want to share with them.
Yeah, well, as the numbers would indicate, Marisol, primarily I think the areas of concentration are Corozal and Orange Walk. Orange Walk had been in this situation maybe 4 or 5 weeks ago. I think the pressing concern would be Corozal, where we have had to do what's called the shifting of health services. You know, in Corozal has, for example, an NHI and a non-NHI element within the hospital. That has been taken away for the time being because of your resources and because of the infrastructure. So that in point of fact, you would have just an inpatient department. There is no patient that in the outpatient that is classified as NHI nor non-NHI. Then you have a ward for persons under investigation, a ward for COVID-19 patients, and maternity wards. So you are basically working with the numbers as you go along. So Corozal, for example, this morning reported that they had 12 patients hospitalized. 6 patients are under investigation, which means they are pending a confirmation of a result, but you treat it as a potential positive case. And you have 6 patients hospitalized are confirmed positive, which means that for that area, they would have 5 beds available. But through the weekend, they went up to 17, which is the max they have had. So you shift your health services based on where you are going. You cancel elective surgeries. You may have to cut back on your outpatient department. Patients that can be discharged and be followed up at home, that can be done as well, or that is being done wherever, depending on the numbers that you are seeing. So I think to answer the straight answer would be Corozal and Orange Walk, and also San Ignacio, Belmopan, we are monitoring closely because of the amount of patients turning up in that area. South doesn't seem to be having that situation as yet.
Um, Next, we have Mr. Jules Vasquez, Channel 7. Jules?
Yes, hello. Good morning. Um, Minister Shabat, sir, since you have been elected on November 11th, 54 people have died, and since you sworn in on were sworn in as minister.
Obviously, Jules, the crisis that we find ourselves in is not one of the making of this government. The results you're seeing today is because of the planning or lack of planning by the previous government, right? This is not a consequence of anything that this government has done or has failed to do. This is the situation we have found coming into office.
Sir, I'm sorry. I hope I'm not interrupting. I can't see you on the Zoom. Um, but really, and this is a follow up because two is very oppressive, sir. Even the Prime Minister.
Is a plan that can be implemented, and we have outlined our plan. And one of the main areas that needs to be attacked immediately is the whole area of testing and getting out test results in a timely manner. One of the things we have now embarked on is the negotiation of an MOU with Baja so that we can start using their facility, their laboratory, as an additional processing site for our PCR tests. And the expectation is that that will speed up the time that it will be required to generate these tests. And so that is one of the first things that we're implementing. And that in addition to the expansion of the rapid test, we expect will have some results down the road.
Okay, and then finally from me, sir, my second. Um, the certainly testing is an issue to find out the level of penetration of the virus in the community, an urgent concern. But really, as Marisol alluded to, the crisis is really in the homes and in the intensive care unit. We see an increasing number of people dying at home, and we know that with the numbers we're seeing that was presented on screen a short while ago, 54 persons hospitalized, 9 in intensive care unit, that the physical space for patients is at the maximum, both in private and in public.
Couple things, Jules. There is a surge facility that is being prepared currently at the Western Regional Hospital, and we expect that that will have space for 25 additional beds. I know that there is an offer from Southern Command for the donation and installation of a field hospital, and so we're also looking at that.
Okay.
Thank you. Next, we have Hipólito Novello from Channel 5.
Hi,
And
good.
go ahead.
Yeah, hi, good morning, Hetable Minister. Under the topic of backlog, and I would agree, my colleague, two questions is very restrictive and sort of disappointing. But in terms of
Hipólito, I think that it is exactly as you say it is. And simply because of the fact that you're currently waiting 10 to 12 days for a PCR result would mean that there are many people walking around who may be positive, but we don't know. And the infographic that you see are only the results of those samples that have been processed, right? And so that definitely is the reality, and that is why we're seeing an upsurge in cases in the spread. And that is one of the things we're working to curb immediately.
in terms of backlog cases, are those numbers include repeat tests or first-time diagnosis?
It would be both.
It will be both. Okay. Now, in one of the, I think, crucial questions would be for you, or Dr. Manzanero, would be in terms of the government returning the canoes back to the villagers of Santa Cruz. You're concerned about these absurd cases in the country and the crisis going on with the pandemic, but you're giving back to these border jumpers in this border community.
I am not so sure which canoes you're talking about, Hipólito. But that's an interesting situation. We do monitor also, as you know, we have always been monitoring what happens in the neighboring state of Quintana Roo and what happens in Petén by their numbers. Our row and our active case, though, is significantly higher in Orangewac and Corozal, much more than their one. Recall their row was similar to ours back perhaps first 2 weeks of August. So I don't know that the risk is there. Of course, the less interaction you have overall with other communities, the less likely it is that you will be escalating those numbers. But at this point in time, I think our row is higher than their one. So that is where the concern would be, is perhaps they should now be concerned about that cross-contamination. But of course, I mean, you're trying to limit interaction as much as you can with other communities.
Up next, we have Love FM. I believe it's Rene Trujillo.
Good morning, Ma'am. Vijay Alvarez with Love FM. My
Who is
first
this?
question,
Who is this?
Vijay Alvarez for Love
Okay.
FM.
Go ahead.
Okay, my first question is for Dr. Manzanero. Doctor, can you speak further on the hospital capacity and what will be done to better prepare them for the surge in numbers that we are expecting to see?
Yeah, well, one of the items that we are doing, especially with the regional hospitals, is cutting back on services like we did initially. And as I said, it depends on the numbers that you monitor every day. So for example, Western Regional Hospital will have to be cutting back on elective surgeries in the time that they are seeing outpatient. In the case of chronic patients, if you can give them medications for 2 or 3 weeks and find some way of supporting that, because you have to shift your staff. You have to factor in the fact that beyond the physical infrastructure, we're also having health staff that is turning out positive, particularly up north. I think Ms. Perez presented some of what healthcare workers would have an active or cases actually. So what you do is shifting of health services within your facility. If in point of fact you start to have a facility that's overwhelmed, then you will have to consider whether you turn it into an actual COVID-19 unit and then channel your patients to the regional hospital, or you can do it vice versa, whether your regional hospital becomes your COVID-19 unit and you channel your patients to a community hospital. You work along with the numbers you have, as has been happening with, for example, Carducci has been gradually expanding their COVID-19 unit, where they initially had 6 ventilators to now they're having the ability to ventilate between 18 to 20 patients. So you expand as you move along with the resources, you fold back some services because you don't have that huge amount of human resources that you can carry forward with whatever you need to do. So you fold back on electives and things that you can, and you basically keep an A&E wing and a COVID-19 situation.
You need to unmute your mic, Love FM.
Yes, ma'am, are you hearing me now?
Yes, you have a second question?
Yes, ma'am, my second question is for Minister Shabat.
Yes.
Minister, good morning. You have spoken of restrictions being put in place, including the curfew. What has been your conversation with the police department to fully enforce these new guidelines?
The Minister of National Security has been fully engaged, and we have asked that policemen assist us in ensuring that the quarantine measures that are in effect and are going to be placed in effect are fully being adhered to by the public. Again, I want to repeat that human behavior accounts for the transmission of this virus, and it is only in curbing that behavior that we can expect to have some leveling of that curve. And so the policemen are going to be fully engaged in enforcing these provisions.
Thank you very much, Mr.
Up next, we have Alberto Vales from CTV3. Mr. Vales.
Hi, good morning.
Morning, Mr. Vales.
I have first of all, I'll also raise a concern with the limit to 2 questions. It's a very serious topic being addressed this morning, and we're normally very direct persons. My first question is twofold, Minister, and the first half is to you, the second half is to the Director of Health Services. Firstly, your situational analysis of where you found the situation is pretty painful and disturbing to have listened to. I know you're also an attorney, would you consider the actions and decisions having taken and some of the inactions taken, possibly dereliction of duty of care to Belizeans, negligent action? The second part of that question will be for Dr. Manzanero, who transitioned from the old administration to this new one. I would want to hear from him whether the situational analysis you presented, summarized on the words "no plan," was the result of his advice to the government then. He is the expert who sat around the table. We would want to know where was the disconnect and how much of what was happening he believes could have been avoided.
Thank you very much for your question, Mr. Vales. I would reserve my comments on your question. I think it has some major legal implications, and at this time, I would not be offering a response to that first part of your question.
The next was for Dr. Manzanero. Yes.
Yeah, well, I think the Minister felt, Minister Shabat mentioned something that in terms of a budget, we would have requests. That's the way it would routinely work. There used to be a task force where we would routinely, as a minister, felt we did not share. We shared it initially March, April, and then that was shared by a CEO in human development then, so that the minister felt was one of the stakeholders where we would take our concerns and whatever needs we had. I think from the get-go, one of the key situations, and the Ministry of Health technical team will allude to, was an issue of finances, where we recognize as a Ministry of Health that the elements of health, we could only do some of it if we had finances and human resources. So some of the human resources we could not get, limited to finances, even in terms of trying to get some of the other items that are clearly articulated now. So we would routinely take that to the task force as a first instance, and then the task force would report it to the oversight committee. At the oversight committee, we basically served as an advisory, and we were requesting on a weekly basis, and that would be decision would be taken higher than the Ministry of Health.
Thank you, Mr. Vales.
Second question.
You actually asked two questions. You
It was
asked
one.
one
It was one question to the two persons.
both.
It's
Okay, go
really
ahead.
just one question. The second question is to Minister Shabat. The National Oversight Committee has not been reconvened under the new administration. Is it your advice to Cabinet that this action be taken?
What we have done, Mr. Vales, is that in addition to the technical team at the Ministry of Health and Wellness that is advising on COVID, we have also constituted a team of doctors and technical persons who are advising the minister and the ministry directly in terms of the steps that we ought to be taking with this COVID pandemic. And so at least that is the model that we're going to be employing for going forward, at least on this next 6-month basis.
Okay, thank you.
Thank you, Mr. Vales. At this time, we call on Ms. Leticia Guerra. Positive.
Hi.
the number of persons who can be in the restaurant at any one time, and to limit dining in. Well, maybe dining in and outdoors is an oxymoron, but but what it is we want to stop in-house dining in closed spaces. Again, we're trying to ensure and to lessen the human interaction, and that is why we are just allowing outdoor dining at this time. Restaurants that have outdoor facilities, and again, it is not a shutdown of restaurants. Other restaurants will be allowed to have takeout.
And will gyms open on Monday?
Sorry?
Will
No.
gyms open on Monday?
Unfortunately, that is not the recommendation at this time.
Okay. Okay, thank you.
Last on my list, we have Mr. William Isigiri, freelance reporter. Mr. Isigiri?
Good morning.
Good morning.
I listened to Dr. Koyar this morning for health facilities on the verge of being overwhelmed and of people about to be dying in the street. And it sounds very alarming. So I would like a response from whoever's best qualified to answer of how many beds are available in the country, given that we're the number cited by Ms. Perez, we have a total of 54 patients hospitalized. How many beds are available to deal with additional cases?
Yeah, well, in terms of the surge plan that
You
we
hear
have,
me?
yes, in terms of the surge plan that we have, which would allow us to make specific areas for COVID-19. So I'm going to give you what would be for now classified as COVID-19 specific beds of persons under investigation. Six available in Punta Gorda, 5 in Corozal, 2 in Orange Walk. Belmopan was full to capacity depending if they have persons under investigation. Southern Health Region, which is in Nagreg, had 3 beds available. Independence had 4. And of course, Carducia has the ability to expand up to 28. And they had 12 persons confirmed and 2 under investigation. So they were about 50% bed capacity. Of course, in part of the search plan that we have, once you have reached this 100%, you can expand further, but then you have to shut down other areas of the hospital and determine whether you convert that into a COVID-19 hospital. But this is, for now, the beds available specific for COVID-19 patients.
Okay, so that's 6 and 4, 10, 5 and 5, 10, 48 beds available. If my math is right. But you're able to expand, and we hope we don't have to. We're hoping not to see that number of cases. Okay, sir. Thank you, doctor. That was my main concern for today. You've answered most of my other questions earlier.
Thank you, William. That's all the media houses I have in the listing here who were to offer questions to the head table. Of note, the minister kept talking about behavior change, and that is something the ministry will be embarking on very soon, a new aggressive campaign on hopefully getting better behavior change in persons to do what is right. A press release should follow this press conference, which will be coming from the government press office, outlining all the recommendations as the minister had mentioned earlier. For the media and anyone in the public who would like to follow up on information, concerns, and queries, the Ministry of Health now has a new COVID-19 communications team, and we ask that persons please direct your questions, queries, or requests for interviews for anybody from the Ministry of Health through that avenue. A contact is there on the press release that will be released within the next hour